Very good afternoon, friends. Meeting again in the session of Materia Medica, and we'll discuss one more very important remedy from the third year as well as fourth year syllabus, that is the Ustilago Maydis. Organ remedy looks like to be organ remedy, but having a lot of action, specifically in cases of scalp psoriasis. Wonderful action I have seen with scalp psoriasis cases. There is one feature called as crustalactia. There is thick layer of the mm, scales appears there on the scalp, and because of which the hairs gets matted together. It looks like to be a very close to the vinca minor in that sense, and a very useful remedy in such types of cases. Sometimes in atopic dermatitis, the similar type of features happens to be there on the scalp, and you get the similar picture. The remedy is again Ustilago Maydis. So this is first important indication. Second important indication, this is the remedy for menopausal complaints, basically in females when menorrhagia appears, long time bleeding, or sometimes even after PPH, after delivery, the PPH happens to be there, postpartum hemorrhage. This remedy works beautifully in such types of cases where blood is little bit black colored blood, and black colored stringy blood happens to be there, having very specific action on the female genital system. So we'll open the Boericke Materia Medica. We'll learn certain aspects of this remedy from Boericke Materia Medica, so that it is a corn smut, and this corn smut appears to be a fungus, and that fungus is useful for such problems. There is first sentence in Boericke has a meaning. There are many patients, many times we do for DUB cases, we ask the patient to go for USG, and USG shows one word, bulky uterus. And bulky uterus without any pathology, that is the uterus becomes hypertrophied, it is big, but and because of which when it never gets contracted, generally it used to produce more bleeding. And this Ustilago Maydis, you have that first sentence, that is the flabby condition of the uterus, hemorrhage, congestion to the various parts, especially at the climacteric, crustalactia. It is crustalactia, it is a thick layer on the scalp where the pus sometimes serous discharge happens to be there, and the hairs gets matted together. The head symptoms, the person is very depressed, full feeling, nervous headache from menstrual irregularities, aching in eyeballs with much lacrimation. So eyeballs aches a lot, and there is a lot of lacrimation associated with that. Male genitalia, uncontrollable masturbation. Underline this sentence. This is very important condition for which this remedy is used. Other than staphyagria, this has a very specific action. Uncontrollable masturbation, spermatoria with erotic fancies and amorous dreams, emissions with irresistible tendency to masturbation, dull pain in the lumbar region with great despondency and mental irritability. So these persons becomes irritable even after doing masturbation. They goes into the phase of nervous exhaustion. They goes into the mental irritated states. This also has a relation with the female genitalia where you get vicarious menstruation. So menstruation is not through vagina. At some other places, the bleeding happens at the time of menses. Ovaries burn, their pains and swell. So problems, it acts on the ovaries producing ovarian pathologies. Profuse menses after miscarriage, discharge of blood from slightest provocation, and blood is partly red, partly clotted. This is very important indication which happens to be there. This looks like to be a sabina like bleeding. Menorrhagia at the time of climaxes. So calcareca, blackasis, these are the other remedies. Oozing of dark blood, clotted, forming long back black strings. That is the typical of this specific bleeding. It is a generally passive hemorrhage which happens to be there, and this passive hemorrhage happens because of the flabbiness of the muscle, the bulky uterus. Uterus is hypertrophied, cervix bleed easily, postpartum hemorrhage, and profuse lochia. So see, very specific action on female genitalia and has a very specific relation with all varieties of bleeding, whether it is menstrual, whether it is post-menstrual, whether it is postpartum. Everywhere this Ustilago Maydis plays a very vital role. Fever, there is abundant sweat, pulse at first accelerated and then enfeebled, and palpitation. But that is not characteristic which happens to be there. Extremities, yes, muscular debility, sensation of boiling water along the back. This sensation has a characteristic theme. Patient always talks words which are given in our Materia Medica, and that has a significance. Many times patient talks in such a sense, डॉक्टर सांग कोणीतरी पाठीत काहीतरी उकळतं पाणी फेकलंय असं वाटतं. This is sensation, same sensation prover has proved, and that's why it is there in your remedy. Chronic clonic and tetanic movements, muscular contraction, especially of the lower limbs. So muscles of lower limbs goes into the cramp state. Skin, you get alopecia. And this alopecia is very specific related with this crustalactia because of the thick infectious disorder of the scalp. You get alopecia over there. Tendency to small boils, skin is dry, eczema, copper colored spots appears over there. Pruritus, sunburn, psoriasis, internally as well as externally. So see, this remedy has a very close relationship to the sickle corn, then sabina, then one remedy which he has explained over there, GI italica, but we don't have good proving of it. We'll not go discuss that. The dose which is mentioned is tincture to third potency, but my suggestion in such types of cases, it is always better to use 12C, 30C, or 200C. You get very good results with such potencies in Ustilago Maydis. Specifically, when you are using for the scalp psoriasis, you must use the 30 or 200. It helps a lot in such types of cases. So we have finished one more remedy from third as well as old fourth year syllabus. Very important from exam point of view, from therapeutic point of view in third year, the gynec therapeutics, this remedy is very useful in writing down the specifically the bulky uterus, hypertrophied uterus, this menorrhagia, PPH, this remedy is very important. So that's all for today. We'll meet at some other time. Thank you.